There is so much medical news to discuss these days, including a new drug that is offering a lifeline to kids with life threatening allergies and using ecstasy to treat soldiers with PTSD. I'm going to be able to discuss those topics and more with our own Dr. Joe Servin of What's Health Got to Do with It on Saturdays at 4. Hey, Dr. Joe.
Hey, Ann, it's so good to be with you this Monday.
Oh, it's so great to have you giving us some house calls. If you have a question for the good doctor, give us a call at 904-549-2937 or email firstcoastconnect@wjct.org. You can also message us on Facebook, Instagram, or tag us on X at FCC On Air. Dr. Joe, I wanted to ask you about a piece that ran on NPR earlier this week. It has to do with a organ harvesting biotech company. It's created in Blacksburg, Virginia. It's a research farm, and it clones animals. It clones pigs to create organs for human beings who need transplants. And it was a really remarkable kind of ethical look at what choices are being made. Obviously, there's maybe more than 100,000 people on the wait list for transplants. There's actual lives at risk. Whether a pig that's cloned is different than a pig that's born, I don't know. But it was a really compelling and really hard, difficult piece to listen to.
I know which one you're talking about, and it is heartbreaking because when you see the pigs, that part that makes you love animals and all that, it really, it just hits you how where we are in terms of trying to find solutions. The other side of that coin of that story, though, is if you talk to people who are dying on the wait list for the organ. I mean, this is one of those things that is such a difficult problem in the organ transplant world. And okay, pig organs may prolong lives and give opportunities for many patients who are in such dire need of these organs to have a second life, if you will. But that cost, I wish that there was a different answer. I guess is the easiest way. I felt the same way. I try to, as someone who grew up on bacon, I try to avoid all that right now, just because it makes you just feel so terrible. But the ethics are complicated on both sides of this.
Yeah, I mean, I think the guy that runs the farm that they interviewed in the segment said, look, this is just a drop in the bucket compared to the number of, animals that are slaughtered every day for consumption. And this is actually a life-saving mission. But, is a cloned pig different than a pig? I mean,
I don't think so. I mean, and that's the other part. Like, you have these genetically modified animals because you have to get them in a way that they allow a human to be able to take that organ so they don't reject that organ. And it's somewhat complicated, but they're still pigs at the end. We're fooling with the immune system with them. But again, I've seen so many sad transplant cases. I'm hit by that, but I'm also hit by just, is this the way we solve it? And I say the verdict is out on that one. We did a show once on xenotransplantation, which is the implantation of these type of organs in humans from other animals. And it's complicated, and it is an area that is growing, but I hope we do find something else.
We are talking with Dr. Joe Servin about neurotechnology, all kinds of things, but he's also taking your house calls. And if you have a medical question, you can call 904-549-2937 or email firstcoastconnect@wjct.org. Okay, moving on to a kind of radical new medical, procedure, or at least medical use of ecstasy and psychedelic mushrooms. The VA is now exploring using these drugs to combat PTSD in soldiers.
This is one that I just didn't think in my career I'd be sitting here talking to you and saying this. Yes, this actually is happening. There is not an approval yet. This is more about clinical trials to see how can we help our vets and others with post-traumatic stress. And there have been certainly some of proof of concept studies that have come back looking pretty good. The idea is that when you take certain psychedelics, MDMA, or psilocybin, which is in mushrooms, it allays the anxiety so much that the person, coupled with talk therapy, can talk about these horrific memories, horrific to them, in a way that gets it to be therapeutic and out there. That's the concept, but you still go through a trip. That's still part of it, and it's the VA is trying to find a way how to reconcile it with the way the federal government views these agents, which are, illegal drugs. But yes, this is being looked at from a very specific clinical trial format, and it could be something coming down the pike sooner than we think.
We've got a call for Dr. Joe. Good morning. Welcome to First Coast Connect.
Good morning. Dr. Joe, how are you? I'd love to listen to your show on Saturday.
Hey, thanks so much. I really appreciate it.
I have this question about, where my ulnar nerve is on my left elbow. I'm a 66-year-old man with, I have osteoarthritis, but I have this really fiery pain in my left bicep every day. And, I put like Salonpas lidocaine patches and stuff on it, and nothing seems to help. Is this the dreaded tennis elbow or something?
Yeah, that's a great question. And thank you for doing it up my alley. As a neurologist, you're asking a classic neurology question. Yeah, when it comes to things like that, and I can't practice medicine on the radio, just to be clear, but this is one of those things that I would actually have checked out either by a neurologist or a general physician. This is it could be a tennis elbow that there are a lot of pressure points in and around the arm. And
Remind us what tennis elbow is.
Well, this is like when you get into a situation where you actually can have nerve compression, and you can get numbness when you make certain positioning of your arm. And so one of the deals one of the things that emerges is sometimes it traps a nerve or something along those lines. And it's one of those situations that sometimes physical therapy can be very helpful, but it's basically trapping one of the nerves.
It can be very painful.
It's painful, unpleasant, and it comes out when you make those certain movements of your arm when you're doing holding a rack in a certain position. But my sense, physical therapists or neurologists would be the best way I would suggest for you guys, for you to move on. But I appreciate the call.
Excellent. And we are taking your house calls with Dr. Joe. If you want to give us a call, we're at 904-549-2937, or you can email us at firstcoastconnect@wjct.org. Okay, this is a topic a lot of parents are paying very close attention to. Last month, the FDA approved, is it Xolair?
Xolair, that's right.
Tell us what Xolair is and why it is considered possibly really helpful or even revolutionary.
So Xolair is a drug that's actually been approved in the U.S. since 2003. So it is not new. Now, it's been used for things like asthma, and it's related to kind of really to try to help relieve asthma symptoms. It can also relieve other things where you have this situation where you can kind of blanch out in hives immediately for those type of conditions. Here they found that if you take Xolair kind of on a regular basis every 2 to 4 weeks, depending on the situation, that if someone who has terrible nut allergy, just to pick one, then it may make, if they're exposed to it accidentally, it may allow them to get through that, as opposed to, in some cases that could be fatal, to basically get through that situation. And to anybody who has those allergies, and there are many out there, as they know, they walk around with EpiPens just to see if they can kind of make sure that they're ready, because this could be life-threatening. That's huge, to be able to do a self-administered injection every 2 to 4 weeks that may then, if you accidentally are exposed to that, you can get through it without having a situation where you are on the verge of death, to be honest with you.
Yeah.
So this is big.
There are some, kids and adults with allergies of that severity, where just even walking into a room, if somebody's eating nuts, that can trigger an anaphylactic kind of response. But are allergies getting worse? I mean, it seems like the severity, people used to get itchy eyes and, you kind of think of like pollen allergies as opposed to something that's, lethal.
This is a question I often ask my friends in the allergy world, because it seems as though there are so many more folks that are realizing they're allergic to XYZ item, whether it's some type of food or some other type of chemical. And so I will tell you that it does seem to be that there is either an increase in diagnosis or an increase in numbers for whatever reason. And so we get a lot of those folks.
We've got a call. Good morning, Regina in Mandarin with a question for Dr. Joe.
Good morning, and thanks, Ann, for your lineup of guests. It's superb. I just wanted Dr. Servan's opinion regarding the RSV vaccine and the CDC's new recommendations for 65 and older getting another COVID booster, and I'll take my answer off the air.
Good question.
That is a great question, and we try to cover this on our show as well. What I will say that the CDC recently made two big changes in the world of COVID vaccine. First change is how long do you have to be away from work or others or school if you have COVID. So I'm going to start there.
And what is it?
It was 5 days. It's now 24 hours of being fever-free, no fever, without medication, and they say that you are safe to return to work.
Extraordinary.
Now, as when we ask Chad Nielsen, our infectious disease doctors, I'm going to call him out because he was on our show recently. He points out that make sure you talk to your HR person to make sure what the rule is, because different institutions may choose to interpret differently. To the point on the vaccine, there was a new recommendation that individuals who are either immunocompromised or 65 years and older should take the additional COVID vaccine vaccine booster, I guess it would be the word to describe it. That just came out. The question that we're having difficulties sorting out is whether that you need to do it by next year, or do we have to catch up now? And that is something we don't know yet, and we're waiting for the CDC to give us those instructions. But yes, if you're 65 years and older, COVID booster is important.
Dr. Joe Servan of What's Health Got to Do with It every Saturday at 4 o'clock. Thank you so much for being here.
And always a pleasure.